Can finasteride stop hair loss for life? Hello, doctors. I'm 18 years old with receding sides, and I wanted to know if finasteride could stop hair loss for life, or at least hold what I have for 20 years. Is it possible?
Thank you for your question. You submitted your question without a photo, and you state that you're 18 years old and you've noticed some receding, and you're asking, can finasteride stop hair loss for life or for at least 20 years? Well, I can certainly understand the basis for your question, and I can share with you a more global treatment strategy that I provide my patients when I meet with them who are concerned about hair loss. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I'm also the founder of TrichoStem Hair Regeneration Centers. This is a system we developed evolving out of hair transplant surgery using a material called extracellular matrix with platelet-rich plasma. And we have been doing this since 2011 and have treated patients from around the world and have developed an algorithm and ultimately have impacted the way hair loss is treated in helping patients who previously were limited to pharmaceuticals and surgery. So I would say that from our experience, and further just to describe what we have done, is basically the concept of regenerative medicine is being applied to help stimulate hair growth. And what we've learned over the many years of doing this is to look at patients in a way that have to do with variables to help us predict a responsiveness to this treatment. When we saw that during in some patients after hair transplant, where we were using this material to help heal the donor area better, to help the hair grafts survive better, that thinning hair became thicker. From that, we started treating patients of different ages, different degrees of hair loss, both men and women, and made a lot of observations as to the relative responsiveness of different patients, and ultimately came up with an algorithm and a system of classification of patient profile. And essentially what I do is I look at patients from the perspective of gender, age of onset of hair loss, degree of progression, rate of progression, other medical variables, and other previous treatments. And essentially I look at what I consider in males as a relative DHT sensitivity. So when you ask a question like, you're 18 and you're starting to recede, the question really is, at what rate are you going to still progress? What you have to understand also is that hair loss is not cured. And so finasteride is not a cure. It is a treatment strategy for managing the rate of progression. It is common for me to see patients who have been on finasteride for 10 to 15 years, since the drug has been out since 1997, and they can look very good. And for them, in my mind, their rate of progression is considerably slower intrinsically. They were put on finasteride, they stayed on finasteride, and what would have been a more significant progression, they've been able to slow down. Other people progress more quickly, and they can look like they have very advanced hair loss, and yet they were also on finasteride for the same amount of time. So what's the distinction? Distinction is that the genetic pattern and the program is different between those two patients. The strategy that I employ in my practice to help people who come and seek attention because they don't like how they look because of the amount of hair they've lost, is to strategize, particularly for men who have anything beyond moderate to advanced hair loss, or in that range, is to use finasteride when appropriate to reduce the DHT level and thereby improve the longevity of the hair growth cycle. Further, since the goal is to maximize scalp coverage, what I've seen is that being on a DHT blocker alone may keep the hair around, but when we use hair regeneration, then that hair becomes thicker, and therefore the synergy is actually quite significant. So finasteride to reduce the DHT, hair regeneration to stimulate hair growth. Yes, PRP acellular matrix does have an impact on hair growth lifespan, and there is certainly a potential synergy in that respect. And much of our patients are not on finasteride and have done very well with the injection alone. However, when you look back at the work that you've been doing, I'm talking about my own reflections on the many different patients I've treated over these several years, I would say that it is clear that there is going to be people who have a higher DHT sensitivity or whose hair is more impacted by DHT compared to other people. And so when I look at anyone who's younger, like yourself, I always think about how aggressive is that hair loss progression going to be. And it's very difficult to anticipate that even with the family history. So I think that if the question is, well, will finasteride keep your hair forever? Well, the reality is it depends on what your particular genetic profile is. But I would say that it is important to recall the original finasteride studies where when finasteride was given to one group and a placebo was given to another group, when the study was actually stopped early because it was obvious which group was getting the active drug, the placebo group got the drug but never caught up in terms of hair count with the group that had the active drug. So the lesson there is the earlier you start someone on finasteride, the better it is. Now, of course, that is with the understanding that a lot of people are afraid to take the drug, and that's a whole other conversation that, in my opinion, has not changed except of this growing perception of fear of sexual side effects, which in my practice and in the practices of my colleagues who I discuss this with worldwide essentially remains pretty much the same. So I think it's important to understand everything, all the variables, and understand further that hair loss is managed. The introduction and now what has become a growing practice of the use of PRP and acellular matrix for hair loss is another tool in the armamentarium of the physician who's trying to help patients with hair loss. But remember, hair loss is being managed, it's not being cured. So meet with the doctor, discuss this situation, and learn about what options seem right for you, and take it from there. So I hope that was helpful. I wish you the best of luck. Thank you for your question.